The Minister of Health, Sibongile Simelane, has called on the nation, in particular communities where there are people suffering from leprosy or those who suffered from the disease before, not to be discriminated, because according to doctors, the infection rate of the disease is very low. The minister was speaking during a meeting of health practitioners where they discussed the disease. Viewers are advised of sensitive pictures. Following a reported case of leprosy in the country, the Ministry of Health has taken it upon itself that it addresses the issue of the disease. The Public Health Unit brought together dermatology nurses from various health facilities in the country, where a specialist capacitated them on the disease. Dr. Dumsile Mabunza, a dermatologist, explained that leprosy is an infectious disease, but chances of getting it from another person are very minimal. Dr. Mabunza explains the symptoms of the disease.
And the symptoms of leprosy, like I was saying, that it's just they are asymptomatic. By asymptomatic, we mean that it is not painful. So it's not painful, it's not itching to bother me to go to the hospital. So patients will have non-specific patches on the skin. They say, hey, I have this round thing in my skin, and it's light in color. What is it? Just like that is 10 years ago. And then it grows slowly. So it progresses very, very slowly over years. So patients do not come to the hospital because it starts very slow and it progresses very, very slowly. And these lesions are asymptomatic, they're not bothering them. Lo and behold, they don't know that this leprosy is also affecting their nerves of the skin. And once they affect the nerves of the skin, we cannot repair that damage that has already been done. Had they known, if they had this small patch that was so small 10 years ago, we would have helped them and would have prevented them from getting permanent damages from the disease itself. So the gross, problems that we see with these patients is that they will lose their limbs, because now they've lost sensation, they can't feel, so they will bend themselves, they will cut themselves, they will get ulcers that they will not even take care of because they're not painful to them.
Dr. Kevin Magadzanga, who was representing the World Health Organization, explained that Swaziland is not amongst the countries where the disease is a problem.
Swaziland is not among these countries because as a country, actually, Swaziland has managed to reach the target of what is called elimination of leprosy as a public health problem. That's when you are recording less than one case per 10,000 population. So if we look at what is happening currently, we have one case out of a million.
The Minister for Health, Sibongile Simelane, explained that when they traced how the patient may have contracted leprosy, they discovered that there was an epidemiology link with a group of 54 leprosy patients who stayed in Buluzi and were reunited with their families in 1994.
As a country, we had about 58 cases that were once treated for leprosy, and that in August 22nd this year, 2017, we have diagnosed and treated a patient, and we are happy to know that through the report from the specialist that the patient is recovering, and also to know that infection rate is about 5% or even less. That also for us, because from the biblical background, we thought that once there is a patient with leprosy, we need to make sure that that person is not next to other people. But we are happy that now we have learned and that the technology and the treatment and also the knowledge has even make us as a country and as to make sure that we don't discriminate people with leprosy.
Dr. Michael Lukele says the team from the Public Health Unit has reinforced their surveillance system, which has always been there, but it has been recording under the TB program, as the bacteria causing leprosy is from the same family with the bacteria that causes TB. Kuku Mapalala from the laboratory emphasized the importance of ensuring that suspicious symptoms are checked thoroughly in one of the health facilities in the country with the dermatology nurses. What the Ministry of Health is emphasizing is that if anyone has a suspicious patch or any of the mentioned symptoms, they must visit the nearest health facility. Reporting for Swazi TV News, I'm Sibusiso Ngubane, Mbabane.